Good afternoon, everybody. Thank you for being here. I'll just go through some data and then a couple points, a couple things we want to highlight, and then we'll just take some questions. Certainly pleased we didn't have any neighbors. No loss of life over the last 24 hours. Certainly want to just take a moment to respect the 203 people in our community that we have lost during this process related directly to COVID, and also remember those who we've lost overall where we haven't really been able to mourn the way we traditionally do. Certainly one of the ways that we've been impacted most in this process. Looking at testing, 1,229 tests in Onondaga County. Yesterday in our region we had over 2,069 tests yesterday, about triple what we're essentially supposed to do. So that's good. That's how we continue to stay in front of this. Each day, for those of you who follow the state's website, our numbers are always a little bit different from theirs. Our information is always a little bit more up to date. And so when we're tracking our 7-day rolling average, it is 0.45%. Certainly we've seen the 0.4 to 0.9% range for our 7-day average for, I believe, 6 weeks now. So when you look at where we are as a region, we're under 1% infection rate. So I think that's really important when we put things into context related to reopening different aspects of our community moving forward. Hospital numbers, we have 17 individuals in the hospital. This number is up 1, but we have 7 individuals who are waiting to go home from the hospital pending a negative COVID test. The governor's executive order, these folks live in a senior facility, so for them to be able to be released from a hospital, they actually have to test negative for COVID. That takes, every person's different. There's no timetable. You can be considered a recovery of COVID but still test positive. So when you look at the number of individuals in the hospital receiving treatment at this point, it's 10 individuals. When you look at the number of folks in the ICU, it's 2 individuals. That's down. That's good news. So 2 folks in the ICU. Overall, we have 3,488 positive cases. That's up 8 since yesterday. Out of these cases, 2 are related to travel. These were not travelers to what we would deem hot states. It just shows you that no matter where you are, if the virus is there, there's risk there. So certainly, please, when you're going out of state, even if it's to some of the states that don't have higher infection rates, please take care of yourselves and your families. Wear a mask. Continue to sanitize frequently your hands, and certainly physical distance when you can. So we have 2 cases still being contact traced as we speak. 4 cases of community spread. That's kind of been the range we've seen. We've seen community spread 4 or 5 range each day. That's very, very good from where we were. And out of the community spread, we have 2 of the cases are from a known source. So we've already been able to contact trace to the origins of those cases. So overall, 8 new cases today. That's really what we've seen. We've seen the infection rate drop. We've seen a range of cases from, I think we had 4 or 5 a couple days to the 15 range, 4 to 15 range. Remember, we were at a 10 to 20 range, before that a 15 to 25. But overall, in our community for a sustained period of time now, we've had infection rates under 2%, and now for a sustained period of time, we've been under 1%. So just fantastic progress. When we look at active cases, 126. This is up 8 since yesterday. As you'll see with the active cases, we've been in this new range. Remember, for someone to recover from COVID, to be considered recovered, you need to have really 7 days of no symptoms, 3 days of no temperature, really a 10-day isolation. So at some point, we hope in the near future, if our infection rate stays where we are, that we'll break through that 100 active case number. We got down to 108 We have new cases every day. People they recovered when they're recovered. And so hopefully we'll get very close to that. That will be another really great plateau for our community. When we look at recoveries, 3,164 people out of our 4,048, I believe, yeah, 3,488 positive cases, 3,164 individuals have recovered to date. So, again, very happy about that. When we look at our cases, 2018 are female, 1,470 are male, 280 are under 19, 675 in their 20s, 472 in their 30s, 424 in their 40s, 515 in their 50s, 403 in their 60s, 297 in their 70s, 262 in their 80s, and 160 in their 90s. Looking at, we've talked a lot about testing, back-to-school testing. Again, we will have partnerships with Upstate Medical, Essentia Health, and Cayuga Medical Center in Essentia Health to do rapid testing for back-to-school. This will be voluntary. We will have mobile testing labs going to schools based off of when their employees are coming back to work. We'll go through the employees first. We know essentially 95% of our cases are adults. So we want to eliminate the risk there first. I believe most of the back-to-school schedules are scattered when the kids actually come back anyways. So then we will then go to high school populations. When you look at the school-age populations, the majority of kids who have experienced this virus are our high schoolers. So we'll then test the high schools. Again, mom or dad or a guardian is going to need to approve of all this. And then we will have a partnership with Upstate to do screening and pool saliva sampling during the school year in the buildings, getting samples, and then screening those for COVID via saliva tests. Then if we have a saliva positive, those folks who are in that pool will then go for diagnostic testing to confirm that COVID is actually there. And at that point, we would begin, if it's a positive, our contact tracing through that building. So we're very, very happy and comfortable with the partnerships that we have. We've seen what we've done with Syracuse University and what they're doing with their incoming students. It's working. They're finding the folks who are positive. Many of those are not coming into school. Some of those that did test negative but then came here and tested positive, those were in our numbers. Those are a very small number of students. They have been in isolation and they're recovering and they'll be better. But when you look at what we're doing, being able to bring more people into our community in a safe way, we're going to do the same thing with schools. And we've put ourselves in a very, very strong position to open schools, open them safely for the employees and for the students. Because of the position we're in, this gives a lot of options to the superintendents and the districts to do creative things as far as back to school, in person, hybrid, etc. So happy about that. We also received more sales tax data since I think we met last. Payment was off, not off by as much as what they have been, but certainly we're looking at a situation where our year-over-year budget numbers are off over $26 million just on the sales tax revenue, essentially 13.3%, and really need to have a strong finish to even keep that percentage right where that is. So we're anticipating probably close to a $40 million to $45 million sales tax gap, and we've already taken measures to mitigate that. But in addition to that, the state of New York has been very transparent of their intention, if they don't receive help, to cut us by $20 million. And then certainly we have room tax losses and we have other expenses related to COVID. And those are expenses that we need to have. We need to be able to continue to do what we've done to keep this economy going, to allow our community to reopen and learn how to live with the virus. Give everybody a couple ideas. We actually have specific sales tax data from March through May now This is really, if you think about the end of March, the economy, essentially the federal government and state government shut down the economy through the month of April. Normally our largest sales tax producer, automobile dealers, during this period of time, 2020 compared to 2019, off 38%, or $120 million. When you look at the e-commerce, picked up 150%, but e-commerce is a much smaller percentage of the overall sales tax bucket than automobile sales are. Gas prices, normally if we weren't in a pandemic, we would be nervous about gas prices, very low, but that's a big producer of sales tax for counties. Gas prices off 28%. That's good for the consumer, not necessarily for the government coffers. Restaurants off 44%, but there was one interesting note that I'm sure people could believe. Beer, wine, and liquor stores up 38% during these months during the pandemic. Essentially what does that mean as far as dollars? Up $10 million in our community in 2020 compared to 2019. Everybody was taking the pandemic pretty hard there. So I thought those were interesting. But certainly we're running out of time. County executives were all on a phone call yesterday with the state asking for any clarity they can give about the timing of some of their decisions. They're on a different budget cycle, an April to April budget. We're on a January to January, so whatever cuts happen, we really need to know what that's going to look like. And if there's no federal help, there's no way around us making tough decisions on reorganizing. I'm talking to the leadership of the legislature now about giving us really unprecedented flexibility where they would give our CFO the ability to cut hours up to a certain level, and then that would give us the ability, based off of real-time information, to make decisions with reorganizing. But at this point, if there's no help, certainly we're going to have to get that permission from the legislature and begin to make tough decisions. Saying that, happy to take questions.
In the past, you've mentioned some school districts seem to be too conservative in the way they were planning to reopen. And given that, I'm just wondering what you think of the city school district's announcement yesterday that they're pushing back the opening to September 14th, and that roughly half of the kids, their parents want to keep them home for remote learning.
Yeah, first, we've always been pretty consistent in our opinion that parents should be given the right to keep their children home, and by certain districts that have larger percentages of parents that are doing that, that provides more opportunity for actually in-person education. Because of physical distancing, you have more real estate. So I think that presents, I don't know if the Syracuse City School District or the board anticipated 50% of parents. Is that really 50% of the parents or 50% of the parents that responded? I don't know the answer to that. That's probably a good thing for you folks to look at, because if you only have 20% of the parents responding, what do the other 80% of the parents think? And you could have quite a situation there. So I don't know about that, but I think that presents opportunities to look once you know these things. I've spoken directly to many. I spoke to the head of the Teachers Union for the Syracuse Teachers Association, got their perspective on some of the outstanding issues that are not really COVID health related, some questions that only the district needs to answer to them. I can't answer that, but it gave me that perspective. But I can say that we have put collectively as a community these superintendents in a strong position, as strong as any position really, to figure out the best way to educate kids in going back to school. The pushback of the start date is not new to us. All the superintendents have been asking us to talk to the state about giving them a little bit more time to do more training with their staff, potentially different types of training with the kids coming back. This is going to be new. If you're an incoming kindergartner, the thought of looking at everybody with masks, these things, this is all different. So pushing back a week or a week and a half, like some of the districts are doing now, that is not news to us. We understand why they want to do that, and we're supportive of that. What I think is interesting is when these districts know more about how many kids are actually coming back to the classroom, does that provide more opportunities for in-person learning, specifically with our elementary age kids? I think that's something they need to reassess and look at, and I know they will. We've had great collaboration over the last week on all these issues. And then also it looked like the city district in particular, they heard from their parents that they wanted the high school students to have more in-person learning, and they added a day a week back. So everybody's trying to get through this. From a public health standpoint, if you look at our 7-day average, there's 0.45% means essentially not 1 out of 100 people has the virus. It's essentially 1 out of 200 people. And so when you think about where we are, and then you think about what we're talking about doing with testing, how do you know someone doesn't have COVID? You test them. And so then you're doing that with the adults because they have carried it more than the kids throughout our community. Then you do it with the kids who have carried it. Then you do the pool testing. In addition to that, you have mask wearing, you're sanitizing, you're cleaning the property, you're upgrading ventilation. By doing all of this, it's really quite an undertaking in putting both the students and the staff in a position for success.
Is each of the 18 public school districts supportive of your offer to test teachers and high schoolers before the school year begins?
I believe so, and we now it's the process of logistics, Andrew. So we've had many conversations about what it's like. Now we're looking at what the days these districts are bringing back the faculty to the buildings, and then logistically setting up the testing days with what partner is going to go where on what day, what partner there. And then it's up to really the faculty to really buy in. You can't make them go get tested, but certainly for everybody to know, at least walking into, essentially think of what we've done in New York as a bubble. That's where the governor puts a quarantine in coming from these hot states. He doesn't want to rupture the bubble without this. Now, we've had travel-related cases, and that's within our bubble now, but it hasn't been enough. And then in Central New York, we've done a little bit better than the state at large. So now we're talking about creating new bubbles, essentially, within our schools because our kids mean that much to us, and so do the faculty that are there. And so how do you make sure that everybody is COVID-free? The likelihood is you're going into the building without COVID based off of our infection rate. And so if you don't have COVID and then nobody else has COVID because you test and then you know, tough to get COVID, and you're certainly probably not going to be exposed to it in that building at that time. So we're doing everything we can, pulling out all the stops so that districts have good options to educate kids so we can make up for lost ground and have a great school year.
Is the same offer, or are the following being included: the Catholic schools, the private schools,
Absolutely.
beyond the public schools?
Yeah, absolutely.
Okay,
Yeah.
and then my follow-up on that is, tomorrow these schools need to add to their reopening plans to the state a policy to test and trace. Do you expect all of the plans for the local schools to basically refer to the county executive's offer to test beforehand, to do pool testing after reopening, and the county health department to do the tracing?
Yeah, we've given the districts the language on tracing, and then we've worked with them on language related to testing. They will not have their own tracing plans. That's our job. So we've given that language. We've helped them go over the testing strategies. Again, this has been This has been a great week of collaboration to address these issues. Once we get through these issues, and then these districts start to finalize what their days are going to look like, then we have to move as a community to find solutions for the gaps in care and any gaps in food continuity that exist. But this is a process, and we're doing it and collectively working well together.
But in terms of the tomorrow requirement, the tracing and testing protocol, you expect all of the Onondaga County school districts to be able to say, Governor, we're using the county to achieve a lot of this. Here's our partnership with them to satisfy your request.
Correct.
Got that second rapid testing machine yet? Or are you still looking at-
We should be receiving one very soon. If Dan Weirs was here, I'd ask him for the exact date, but any day, hopefully. And then, yeah, we're essentially buying a second rapid testing machine. Upstate has their very large testing infrastructure that will be up in place at the end of August as well. Our partnership with Cayuga Medical has many of these Ronix testing machines already. So essentially, we're going to be putting those machines there, adding to that capacity, and then we're going to be using all their capacity, not just our machines. And then if they need our machines when we don't need them, they can use them as well. So we will have a lot of significant rapid testing resources. Number one priority is getting back to school, but after that, we'll have this at the disposal. We'll be able to use this anywhere in the community, essentially. So some of the backups at some of the other testing partners' sites, because they're using the national labs, we'll be able to use essentially this rapid testing to get the results back quicker, and that way we can begin our tracing when necessary much faster. And that's something, too. Think about this. I know there's been many people that have reached out to you that went to the Syracuse Community Health Center or their own doctor, said, I'm waiting on Quest, I'm waiting on this national lab, that national lab, because they're asymptomatic. If they were symptomatic, it wouldn't have been as long. But all that waiting, most of those folks did not have COVID, right? But even though we had that time of a delay, that delay and any positives that took longer to get to, that's all baked into our numbers. So you look at our infection rate, the things that were working against us was the labs were backed up for a period of time. That's reflected in our numbers now. You look at the travel, that's in our numbers now. So we've positioned ourselves where we're in a really good spot, so we can take a couple new cases here and there. That doesn't hurt our infrastructure, not at all. So that's what is really why we're confident about being able to continue to take that next step, live with this virus, is because of where we are as a community, and it's something everybody should be proud of.
Will the teachers be the widest spread use of rapid testing so far?
Yes. Yeah, by far.
Because right now it's limited to really hospital workers, is that accurate?
Essentially, yeah, hospital infrastructure. The turn times at Upstate are very, very good if you have an appointment with them. So you're getting that there, but essentially think about folks in a hospital, workers, potential people that they need to test for, emergency type procedures. Elective surgeries are coming very fast too, but that's not what you'd use a rapid testing machine for. So our local and state lab turn times are very good. It's the national labs they're solid on symptomatic. The asymptomatic, not as strong.
You've said this before. What will your capacity be for rapid testing once you have all the expected machines and equipment with you?
Well, it's going to be even stronger now. So you're looking at probably with our partnership with Cayuga Medical, and they're continuing to also bring on more capacity. Essentially, we're going to be looking at probably 3,000 to 4,000 tests a day. That turn rapid tests, yeah.
And other counties, teachers might want to get tested. Is this open to them? You've been such a regional partner. Does that continue through the
so
back to school?
there's crossover with BOCES and different in Madison and in certainly Cayuga. And again, Cayuga Medical, they service Cayuga, they service Tompkins as well. So this is a regional issue. It's a statewide issue. we're upstate services so many different counties. We've been think about the medical infrastructure of the community with the hospitals during this process. These weren't just county residents coming in and being hospitalized. They were throughout all of northern and central New York. So certainly everybody will be a partner to take care of our sick and our neighbors when it happens. But we're on the regional control room calls every day with different leaders from the different counties as far as central New York goes. And if there's a gap, I'm sure they'll be there. But some of their local hospitals are building up different infrastructure as well. And when you don't have the population that we have, some of these counties, 50,000, 75, 100,000 people, you don't need the type of rapid infrastructure that we have when we have 460 to 470,000 people.
Do you have an estimate of how many people in the schools might need to be tested between the adults and some of the high schoolers?
So are you talking about the screening, the moving forward? Or so with the adults, we think there's probably, essentially 8,000 employees that we would hope that everybody would, because that's a concern, right? That's one of the concerns that people are bringing up about going back to work. So here's an answer to that concern, so we hope everybody would. As far as the kids, that's going to be trickier. The districts certainly know how many kids in high school. I think the kids in high school, a lot of them have already done this. There's high school kids are getting this. So if one person gets it, oftentimes we tell everybody in a group, please, get your kids tested. You've heard us talk about that. But there's a lot of high school kids that we would recommend to parents. They've been social. They've been hanging out with their friends. They've been going different places. They're more mobile. They're not like when I was in high school, you hung out on just your West End mile with other kids in that area. These kids know everybody, all parts of the county. So testing them will be important, but that's going to be a decision for their parents and their guardians to make that call. But the saliva pool testing, again, the employees and the parents are going to have to agree to this, but this is it's not the nasal swab, it's a saliva test. So initially the thought process would be people would be pretty comfortable with the ongoing screening, and we'll let our partners at Upstate determine what they want to see within a building, how many in a building, where, what age demographics. Essentially, one pool sample will have 12 different saliva samples on it, and we'll let the scientists determine what kind of background and demographics they want to see into that.
Knowing nursing home employees were required by law to be tested, is there a mechanism at the state or even county level to require that of teachers?
I think so you have two different things here. Sure, the governor could do it, and if we thought it was necessary, we could do it and ask the governor's health department for permission. They're different because we know what the virus does to the demographic, and we know what it does to people who live in nursing homes, right? If you're in a nursing home, pre-existing medical condition, for many people it is home. They're over 70. The virus has been brutal on that demographic, and we saw what it did across the country in New York State. And so we also know once it gets in the facility, it's spreads very quickly. So that was the reasoning behind it. Schools, again, you're starting off from a position of strength, and you're strengthening it. So I don't see the state making that request unless the data showed that you need to, right? This wasn't the norm in the beginning with nursing homes. After seeing what happened, the data showed there's a problem. What can you do to mitigate that risk? Here comes the EO. Right now, we're in a position of strength with the infection rate. We don't have that problem. When you look at school-age kids, we know, based off the data, where the virus has been, and essentially the high school folk kids, and then certainly the elementary age kids. Again, we'll say it's worth saying every time, 4 through 9, we've had 22 cases during the pandemic out of the 3,488. Everybody can do the math. It's well under 1.5% of our cases. And as important, we can contact trace back in all those cases, and we know where they got it, and we know how they got it. And it was, essentially from a family member.
We've been getting a few emails into the newsroom about people not wearing masks on Central buses. Have you gotten any complaints about that?
We have not seen that. That doesn't mean it's not happening. People need to wear a mask on a Central bus. People need to wear a mask if they're going to be within 6 feet of someone else. That's the rule. We have a dedicated unit in county government made up of investigators, lawyers, health department, and probation officers that have been enforcing the rules in businesses, and certainly if they run into somebody not wearing a mask, they're going to enforce that rule too. So we know better. We know it works. There's a reason we're here today talking about why we can safely take the next step forward on reopening our community. And it's because mask wearing has worked, physical distancing has worked, sanitizing has worked, testing works, tracing works, all these things. Let's not get foolish now.
I didn't hear the number you gave at the outset of the number of tests that you received back over the past day. Was it 1,229?
1,229 tests back since yesterday, and 8 cases.
8 positive.
8 positives, yeah.
Thanks.
Other questions? Okay. Well, thank you very much. Everybody, please enjoy the weekend and be safe.